Hello, good evening, my friends. This is Dr. Brandt Gibson, and today I want to talk to you about fungal toenails or onychomycosis. Fungal toenails is an infection, just like a bacterial infection that you may have, like a strep throat, but it's caused by a fungus or a yeast, and it can actually affect the nails themselves. There are multiple different types of onychomycosis or fungal toenails. You can actually get a superficial onychomycosis, which is just an infection on the top of the nail. So it'll be right on the tip. It a lot of times will be chalky or may look like powder on the nail itself and can be almost scraped off, and it doesn't seem to affect the nail itself. And this is significantly less common, but also significantly easier to treat, because since the fungus is on the top of the nail, a lot of the topical type solutions will work without any problem. Number two is the most common. This is the type of fungus that will actually affect the nail itself, and it's usually caused or usually presents itself after you injure that toenail. Whether you have an ingrown toenail, whether you damage it from running, whether you kick something and it lifts the nail, whatever the reason, the fungus gets underneath that nail and it starts to thrive. And it'll present in multiple different ways. The most common is you'll have a thick, discolored nail that looks like it's dying, basically. It can be yellow. It can be more almost a black discoloration, though typically it's not a true black. It just looks darkened. And it will usually be quite thick, or can get quite thick over time. And in a lot of cases, you'll actually have crumbling underneath the nail that you could even clean out and actually make the nail look better just by taking all that junk from underneath the nail, which is an indication that you truly have an onychomycosis. Now, onychomycosis, just because you have a thick nail or just because you have a yellow toenail, does not mean that you have onychomycosis. So tomorrow we'll be talking about bruising to the nails or subungual hematomas, and the day after we will be talking about other reasons why your nail may not look normal. But today we're talking just about the infection in that nail itself. So if you have that infection in that nail, the question that I'm commonly asked is, can we just remove the nail? Will that fix the problem? The answer is no. Most of the time, probably 95% of the time, the fungus is growing from where the nail is growing from. So you take the nail off, you say, okay, I fixed it. It takes about a year to grow out. By the time it grows back out, it's exactly the same. It looks the same. It's a thick, discolored nail. And so what you have to do is you have to treat the fungus. Side note, a lot of times when you have a fungal toenail onychomycosis and you're not treating it, you will find that you keep getting athlete's foot or tinea pedis back. The athlete's foot comes back over and over and over again because you can't get rid of it, because the fungus is still in the shoe, it's still on the foot, still on the toenail. And so it keeps progressing back to the skin, and so you get the red, itchy, even sometimes bleeding, cracking areas between the toes or on the bottom of the foot that are consistent with an athlete's foot or tinea pedis. So the good news is tinea pedis is relatively easy to treat. You can treat it with topical products such as Tinactin or some of these other antifungal powders or sprays or even creams. I recommend, if you're going to do an athlete's foot treatment, that you use Lamisil cream or Lotrimin Ultra, because they work more quickly and they're usually better than a lot of the prescription antifungal medications for athlete's foot. An even better option that also does work some on onychomycosis is tea tree oil or melaleuca. A lot of times with tea tree oil or melaleuca, you can actually get rid of the itching and the cracking and the peeling that comes with athlete's foot relatively quickly, within 1 to 2 weeks of doing it twice a day. So the advantage of that is it actually also can be used to treat the fungus in the toenails. The reason why is tea tree oil or melaleuca oil will actually penetrate the nail. So if you're going to use a topical treatment for onychomycosis, you need a treatment that will actually penetrate the nail, because the fungus actually lives underneath the toenail. So if you paint it on the nail and it stays on top, it will not treat most types of onychomycosis. So you need one that will penetrate the nail. There are also pills that can be taken that will similarly reduce the amount of fungus that is in the toenail. And there are some forms of laser that have been shown to work. You just need to be careful and make sure that the laser that's being used is actually one that is indicated for and works for an athlete's foot, because, or not an athlete's foot, a fungal toenail or onychomycosis, because most of the time insurance will not pay for a laser treatment. So you're paying for it out of pocket. So you want to make sure that it actually is functional and works well in treating onychomycosis or fungal toenails. So what do you expect to see with onychomycosis? Thick, discolored toenail, a lot of times with crumbling underneath. You may have an athlete's foot, which is the red cracking, peeling between the toes or underneath the skin or underneath the foot. And it should be treated with a topical treatment that actually penetrates the nail, an oral treatment such as terbinafine, or a laser if it's the right type of laser. The good news is onychomycosis is not life-threatening, and sometimes just thinning out the nail will keep it from being problematic and painful, though a good treatment for onychomycosis is usually the best option because you can get your nails back and they can start looking normal again. This is Dr. Brandt Gibson. This was your podiatry tip, day number 9. Like I said, tomorrow we'll be talking about bruising of the toenails or subungual hematomas. And the day after we'll be talking about other reasons why your nails won't look normal. Onychodystrophy is what we like to call it.